He currently serves as an assistant professor and as the associate program director of regional affairs, justice, equity, diversity, and inclusion at MedX at the University of Washington School of Medicine. There he serves on the PA faculty, on the faculty senate, and he has an appointment in the Department of Family Medicine, where I just learned yesterday that he was named assistant chair of the Department of Family Medicine. Unusual for a PA to serve in a leadership role in a Department of Family Medicine. He holds specialty certifications in health education and in healthcare information and management systems. Dr. Sturges' academic and research interests include the intersection of medicine and social justice, the imposter phenomenon in underrepresented minorities in medicine, burnout in underrepresented minority medical faculty, health promotion and education, serving the medically underserved populations, and the role of social determinants of health in clinical decision-making. In addition, Dr. Sturges is professionally engaged in the PA Education Association as the chair of their Diversity and Inclusion Mission Advancement Commission, and he serves as the featured editor for the Journal of PA Education's Justice, Equity, Diversity, and Inclusion efforts. Additionally, he's active in his fraternal organization, Alpha Phi Alpha Fraternity Incorporated. His practice has been across disciplines of primary care, internal medicine, orthopedic surgery, and rheumatology. But his passion throughout his clinical career is about the holistic care of families. He views medicine as his ministry and considers it an intrinsic duty to promote and deliver high-quality health care. Dr. Sturges, thank you for coming home to inspire the next generation of healthcare providers and what promises to be a provocative and enlightening commencement address.
Well, it does feel good to be home. But first, let me offer my congratulations to you all on the completion of one of your life's goals and the beginning of the journey that lies ahead. On a personal note, it does feel good to be home. And when I say home, I have to mention this 18-time state champions, Haynesville, Louisiana Golden Tornado. But I say home because, honestly, when I say home, secondary to this pandemic, you all know home very well, unfortunately. As you represent the resilient scholars who completed the majority of your studies remotely, and for rolling with the punches and overcoming adversity, and sitting in this seat today, I want you and everyone around you to offer a round of applause because you are most deserving. Next, I want you all to stand, and I want you to turn and look at your family, your friends, your faculty, your staff, your administrators, your global view, and give them a thunderous round of applause as well, as these unprecedented times activated skills and emotions that we did not even know we possessed. So let's give them a thunderous round of applause. Thank you to the village that created these graduates that are sitting before you today. And the pandemic did give us two more things. It gave us Tiger King and Carol Baskin. So there's that, right? See, I gotta laugh. Good. It is such an honor to be standing here today, offering you words of congratulations and hopefully some pearls that will sustain and guide you throughout your life. This is a surreal moment because I was once criticized for my voice. Not what I had to say, but how I sounded. So during my undergraduate days, I'm gonna share a story with you. I really wanted to be an orientation student leader. You all remember those orientation student leaders? That looked like a fun job, right? So I severely wanted to be an orientation student leader. So I tried out a couple of times, no success. I did decide to seek feedback so that I could show up and be better the next year. You see, one thing my people taught me is that you never give up. So guess what my feedback was? My accent, and the fact that I barely moved my teeth when I spoke. Now, those of you who may know me can imagine the look that was on my face when I heard those words drip out of the sponsor's lips. I politely said, thanks for the feedback. And I left. You see, in that moment, I had a choice to make. Would I show up in the world authentically, or would I conform to become a representative of who others wanted me to be? Now, you hear this raggedy voice, so you know which route I chose. And I'm speaking to you and still barely moving my teeth, so. I challenge you, all of you, to be your authentic selves. Be authentic with your family, your colleagues, your future patients, and the world around you. You see, authenticity has afforded me the opportunity to speak to you all today and on stages across this nation, delivering a message that I hope is catered to you all as the people. Use your unique treasures and cultivate them to show up and show out. You will go much farther in life just being you, because nobody can do it like you. Imagine how boring this world would be if we were all the same and conform to societal norms. Diversity is the spice of life. And I mean, this is Louisiana, so you know we like flavor. We are often taught that in the United States, we are a melting pot. But just imagine a concoction where everything has been melted down to this grayish, tasteless, boring slop. Instead, I say we represent a gumbo. Why? Well, we all represent individual, communal, and cultural dimensions that can all stay the same and contribute to a delicious whole, just like the roux, the shrimp, the sausage, the crab. You know, you get where I'm going with this, right? So every ingredient maintains its original form, and it maintains its own integrity. And together it makes something that everybody can enjoy. So that's diversity, right? So in this case, I just made you a nice gumbo, but I do have to consider, you know, some people have seafood, shellfish allergies. So on the other hand, let's just be healthy and make a salad. But it worked, the same analogy works. So, but you get what I'm saying. Dr. Maya Angelou is my spirit guide. And in her 1993 poem, On the Pulse of Morning, that was delivered at President Clinton's inauguration, she spoke words that I tucked deep into my third grade heart and reflect upon each time I nurture one of my unique gifts or I try to develop a new dream in consideration of how I use it for uplift or how I can benefit the larger society. She said, lift up your eyes upon this new day breaking for you. Give birth again to the dream. Take it into the palm of your hands. Mold it into the shape of your most private need. Sculpt it into the image of your most public self. Lift up your hearts. Each new hour holds new chances for a new beginning. Do not be wedded forever to fear, yoked eternally to brutishness. The horizon leans forward, offering you space to place new steps of change here on the pulse of this fine day. So being authentic does not mean you all of a sudden do not have the ability to learn, grow, or change your mind, or even acquire new skills. Do all of that. Apply action to what you've learned and do it with a sense of personal style. Because again, when you are uniquely you, nobody does it better. As you venture out into the known and the unknown, whether it be direct patient care, research, programming, policy, or laboratory services, I have no doubt that you will fully immerse yourself into your profession and professional organizations. I encourage you to give your personal best. That level of achievement is what success looks like. Our queen, well, at least my queen, Dolly Parton, offers that you will never do a whole lot unless you're brave enough to try. Trust me, you all possess the necessary bravery, the grit, the tenacity, and because you all took on this rigorous course of study and have reached completion. So, and to steal a line from one of my favorite documentaries, Paris is Burning, it do take nerve. You had the nerve and the audacity to pursue your dream and the unmitigated gall to finish it despite it all. As our country endured a needed reckoning regarding social and racial issues and laying bare the healthcare disparities that exist, all juxtaposed against navigating and surviving a pandemic. If these historic times have taught us anything, it is that life is fragile. Life is worth living, and life should be enjoyed. Again, my last Dollyism, I promise. Don't get so busy making a living that you forget to make a life. Now, this has been a pitfall in my personal journey that I'm just not trying to rectify as I enter into a new decade of life. Hey man, Ambition is good, but at times it's blind. Not blind ambition for you Madonna fans, but blind ambition can sometimes leave you with a career, and that's about it. So as you move forward professionally, make your career a part of your life. Do not make it your life. Harkening back to your dreams and unique gifts, find a way to incorporate them into your new profession and bring in your friends, your family, and your social support system to enjoy the ride as you fulfill your passions. Remember, support is a two-way street and it should be reciprocated. As you experience the highs and lows of what lies ahead professionally, be able to recognize and celebrate the good times, and be able to recognize, like B.B. King says, when the thrill is gone. So there may be times when you experience a term that we have heard frequently over the last 2 or 3 years, burnout. Burnout is chronic occupational stress described by emotional exhaustion, cynicism, and a decreased perception of personal accomplishments. One thing I want to make clear on today is that burnout is not an individual malady, but a symptom of a larger organizational issue. Unfortunately, not many people view it as such, and inadvertently place the onus on the affected individual to just work through it. Well, I'm here to tell you that it rarely works unless there are large-scale interventions that are employed in the work environment. Burnout has actually led to decreased mental health, suicide attempts, and completed suicide, absenteeism, and large-scale turnover in our healthcare colleagues. The exact opposite of burnout is job engagement. So why do I mention this topic to you all? It's not to scare you. However, any message I try to deliver is in essence a love letter to my audience. And I've been through burnout. You may experience burnout. However, I want you to be able to recognize it for what it is and do what is best for you to get over to the other side of it. Many of you will go on to be organizational leaders, and I encourage you all to prioritize workplace health, burnout prevention, belonging, justice, equity, diversity, and inclusivity. These tenets and practices will not only sustain you, but also the many lives you will touch in your professional reach into society and into spaces unimaginable to any of us. As I conclude this pilot to my upcoming self-help podcast, I want to leave you all with a challenge. Let's consider Bossier Parish and Caddo Parish. Both locales are in close proximity, only separated by the Red River. However, Bossier Parish is ranked number 7 out of 64 parishes regarding health outcomes, while Caddo Parish is ranked number 45, according to the most recent county health rankings by the Robert Wood Johnson Foundation. This highlights gaps in accessibility, mortality, and morbidity in our own backyards. You all have the skills necessary for success in both the clinical environment and our research in the public domain. Leaving here, you all will possess the privilege of education, the privilege of access, and the privilege of a higher socioeconomic status. You are now an authority figure. Show up for your community as change agents. Embrace a spirit of inquiry. Be culturally humble. Advocate for health equity. Assess and address social determinants of health. Join the front line in closing these health disparity gaps and become an accomplice in promoting and achieving social justice. As I take my seat today, I have one request. Keep nurturing your unique gifts and always dream. Lift up your eyes upon this day breaking for you. Give birth again to the dream. Take it into the palm of your hands. Mold it into the shape of your most private need. Sculpt it into the image of your most public self. Lift up your hearts. Each new hour holds new chances for a new beginning. Congratulations to the LSU Health School of Allied Health Professions, class of 2022. And just like the lyric to our other queen, Beyonce, and the Alien Superstar, just remember this mantra and carry it with you. I'm one of one, U-N-I-Q-U-E. Say it with me if you know the song. Unique. All right, thank you all for the opportunity and congratulations once again.